My name is Dr.Gul. I'm general surgeon. My special area of interest is obesity surgery. Obesity surgery is mostly performed commonly in all around the world nowadays because obesity is a major problem worldwide, and there are various treatment methods for obesity surgery. One of them is sleeve gastrectomy that we're going to talk about. Sleeve gastrectomy is a type of operation that we restrict the amount of food that you will consume. Approximately 75% of the stomach is removed. The operation is performed under general anesthesia, and it's laparoscopic operation. Laparoscopic means it's minimal invasive. So what does minimal invasive mean? We just make small incisions, small 5 incisions, and through those incisions we insert a camera and other instruments that's necessary for the operation. And the operation takes around 45 minutes, around 45 minutes to 1 hour. And after the operation, you will stay at a hospital for 2 nights maximum, and then you will be discharged. Because the operation is performed laparoscopically, after the operation there are minimal scars on the body that will be almost undetectable after a few months. Sleeve gastrectomy can be performed under general anesthesia, I have told before, and the patients who are eligible for sleeve gastrectomy are defined by the World Health Organization. There's a parameter that we use, we call body mass index. If your body mass index is above 40, that means that you're eligible for the operation. And if the body mass index is between 35 and 40, and if you have an additional disease such as diabetes mellitus, hypertension, dyslipidemia, or sleep apnea, or arthritis, and also that you're eligible for the operation. If you have a serious alcohol addiction or drug addiction, or a severe psychiatric condition that is not under supervision with a psychiatrist, and then sleeve gastrectomy is contraindicated. There are lots of questions coming from our patients, such as when do I have to stop smoking, when do I have to stop drinking alcohol before the operation? The answer is you shouldn't consume alcohol at all, because alcohol has too much calories in it, and after the operation if you keep consuming alcohol, and the goal of the operation will fail inevitably. And regarding smoking, because in obese patients the lung capacity is normally decreased compared to the normal patients. And if you also additionally smoke, and the lung capacity will decrease much more. And then that's why we want from the patients to quit smoking at least 1 month before the operation. We also demand from our patients that before the operation, approximately 15 days prior to the operation, the patients should go on a low-carb diet in order to reduce the size of the liver, and just to have more, familiar with the diet they have to follow after the operation. Although it's a laparoscopic operation, we want to be careful about the drugs that the patients use normally. Especially the blood thinners should be stopped before the operation, at least 5 days or a week, that we could be consult to your doctor. Before the operation, there are some routine tests for the anesthesia. Those are the blood investigations, chest x-rays, ECGs, and the cardiologic examination, an ultrasound, and of course upper GI endoscopy in order to evaluate your stomach to see if there's an obstacle for the operation. After the operation, there are some strict rules that you have to follow. One of them is the diet. After the operation, for 2 weeks, you have to consume only liquid without particles in it. Okay, that's very crucial. And after 15 days, another 15 days is coming that you have to consume only smashed food or puree. In the first month after the operation, you will lose approximately between 15 or 20 kilos. And after the first month, and every month, it will be like 3 or 4 kilos per month. When you just reach your ideal weight, the weight loss is going to stop eventually. You can increase your weight loss by regular exercise or following the restrictions and just not consuming high-calorie liquids or food. There are three main principles that we demand from our patients. First, one of them is that the patient should eat 6 meals a day for entire life, okay? 6 meals with chewing very well before swallowing, and after the main meals, before half an hour and after half an hour, you shouldn't consume liquid or water, okay? You shouldn't mix solid food with water. That's very crucial. And the second thing is the patient should consume minimum 2.5 or 3 liters water per day. You should always carry a bottle with you, and you should consume water before the feeling of thirst, okay? You should always drink sip by sip, because it would be impossible for you to drink in a long shot because your stomach volume will be decreased. The third main thing that we demand from our patients is they have to spend time for themselves, at least 1 hour for walking. If you have a desk job, you can go back to your job after a week. That will be enough for you. If you have a job that you have to lift heavier things or something, maybe 10 days or 2 weeks is going to be enough for you. After sleeve gastrectomy, it will take almost a year for you to get pregnant. After sleeve gastrectomy, or generally speaking, obesity surgery, skin sag is a common feature. If you want to decrease the amount of skin sag, you should consume proteins, you should do regular exercises, and if it is inevitable that you wanted to have a plastic surgery, it should take at least 1 year after the obesity surgery. After the operation, you will start to walk after 10 days, and after a month you can start regular exercises, and after 3 months you can go to the gym. In sleeve gastrectomy, we remove approximately 75% of the stomach, and that's a restrictive type of operation. In gastric bypass, we leave a small pouch of stomach, and then we connect that small pouch to the small intestine, and that causes malabsorption, and through that mechanism the patient will lose weight. The patient will reach its ideal weight approximately around 12 or 16 months. Intragastric balloon may be another option for treatment of obesity, especially the patients who are at greater risk for operations under general anesthesia, or for the patients who are afraid of the operation. Gastric balloon may be a good alternative. Swallowable balloons. Those balloons are placed intragastrically without endoscopy. How it works like a space-occupying mass. So the amount of food that you will consume is going to be decreased. But after 4 months, it will dissolve, and you pass by the digestive system. And during those 4 months, you have to adopt those right behavior pattern throughout your life to maintain the weight loss.